Yeah, now we are going to talk about speech delay versus autism. And many parents confuse the three because autism, it also has autistic children, they also have speech issues. And speech delay children, they also have speech issues. So many parents who have autistic children, they think their children, they just have speech delay. Others who have also speech delay, there are parents who come to you and tell you, my child, I think he has autism, yet it's just speech delay. Let's first look in the perspective of, first, what are the parts of the brain are affected for these two different children. First, for autism, it composes different parts of the brain. There is white matter, which is also affected. There's the Broca's area where we have white matter, where we have neural networks that connect to different parts of the brain. And also we have Broca's area where we have speech production, and which confuse the parents because my child is not able to produce speech. So therefore, a parent who has a child with speech delay, he end up thinking that his child is autistic, yet he's not autistic. He just have that speech production problem in the Broca's area. So for autism, there is Broca's area where we have speech production. That one is affected. There is in temporal lobe where we have auditory cortex with sound processing. So that one is affected because what he hears, he needs to process and make information out of it so that he can respond. So the problem we find is mainly not about hearing or auditory nerves. You find the problem is with processing what he heard and get information about the sound. So those two parts are affected, but also you find in the amygdala is also affected. That's why you find they also have emotional issues. Some even cerebellum, and so with coordination, you find also a child has that one. But mainly the part which is affected the most is the prefrontal cortex. And now for speech delay children, it's a different thing. For them, it's mainly the Broca's area where we have speech production. You find his neural networks in the auditory cortex are working very perfectly, but the problem is now he can hear and process information out of what he heard, but the problem now is now making a sentence out of what he heard. But you find he doesn't have signs of autism. Now let's look at the signs themselves. First, autistic children have eye contact issues. Second, autistic children, most of them, they have hyper because of higher cortisols in the system and overactive nervous system. Autistic children, most of them you find they have insomnia. Autistic children, most of them also they have that picky eating habits. And some of them you find they also have fecal incontinence. But that is not necessarily the case for speech delay children. For speech delay children, you find mainly the problem is with speech. He has no problem with eye contact. He has no problem with sleeping. He has no problem with toilet trainings. He can use toilet and is not on diapers. He has no problem with hyper. The problem he has is only in the Broca's area where we have speech production. But like I always tell parents, when you find your child has one of those issues that we said, and you are lucky your child is still below 3 years old, my friend, you have a chance. You can change the course of life. You can change his course of life. We have seen many children being trained, being helped, getting intervention, and some end up speaking, some end up even writing, some end up performing most of the things normal kids do. But that one happens for children who are still young. But now, when a child now is 9 years old, 12 years old, 13 years old, you can't compare that child with a child who is below 3 years old, where we have where the neuroplasticity is at the peak. At that moment, anything can be changed. Actually, for us, when you bring a child who is 3 years old or 2 years old and he has speech delay, hyper, low concentration, poor eye contact, that's a piece of cake. With that, we are able to make intervention with Kunga therapy and speech therapy and others. And you find after some 4 months, a child at least can make some sentences, can concentrate. But now for a child who is above 10, above 12, above 15, it's very difficult. Still we try, but it's very difficult. And the problem we have many parents, they neglect it. They first stay in denial, say my child doesn't have autism, it's just speech delay, let me wait. But the longer you wait, you are actually denying him the best time when he should be getting treatment. So that's the difference between speech delay and the autism. First, in the parts of the brain that are affected, again in the signs we see. But again, parents, if your child is still below 3 years, please don't leave him to chance. You can change a lot of things in his life. Only if you get him for intervention at that age. Below 3 years old, below 5 years old, the neuroplasticity is working the best.